Nick Lolatgis is my name, and I'm an infertility specialist. The journey sounds complex, difficult to some people, but what I want to do is give you a snapshot of what actually happens when you come through for treatment. We try and make it as easy as possible for the patient, as welcoming as we can make it, and the process itself is quite simple, but for the untrained it seems difficult. So in this video we're just going to show you a few of the small procedures that occur in theatre, how you're looked after, how well you are looked after by a very, very dedicated, caring team who only have one thing on their minds: what can we do to help this woman achieve her dreams? And it's all focused on that. And the whole composure, the whole passion within the group is to achieve that. And you're in very good hands.
So this is the final part of the journey. You've come into the hospital, you've been admitted, and you've been brought into the operating theatre. You've been put to sleep, your legs have been put up in stirrups, you've been draped, and we're ready to go to the egg collection. And the exciting thing for the doctor is how many eggs are we going to collect. We're listening to the embryologists as they go 1, 2, 3, 4, 5, 6, 7 eggs, and we like to get between 5 and 15. And of course for us, it is accomplishing that process for you that gives us the excitement, especially when we come and tell you at the end, you've got 10 eggs or you've got 12 eggs. And that is the end of the journey for you, and the rest of the journey happens in the laboratory where the embryos are grown, and eventually they'll be transferred back into your uterus and a pregnancy. So the whole process is very safe, it's easy, and the anaesthetic is very light. So before you know it, it'll all be over and you'll be going home, out to lunch with your husband, who knows, the pictures maybe, or picking up the other kids from school. But for you, it's a very safe and simple procedure. And of course, again, this is a team effort, and without the staff, Nurse Lisa here, playing with the tubes, collecting and holding the tubes, handing them off to the embryology lab, this is what makes this place so special. The team effort here is fantastic, and we all have one thing in mind. One aim is to get you through this process safely, this journey, and for you to have a baby. That's what it's all about. I've been around for a long time, ever since IVF started back in the 80s, and in those days all the eggs were collected laparoscopically. This means we had to put a telescope through your belly button, you had to have a full anaesthetic, and we had to put other little holes in your tummy to put needles into the ovaries to collect the eggs. This was changed dramatically when ultrasound was developed. So now all the eggs are picked up through the vagina. Correct. How can we get to the ovary through the vagina? Well, it's simple. If you think my body is the uterus and my arms are the fallopian tubes, under my armpits are the ovaries, and they hang down. And the ovaries are a couple of millimetres from the top of the vagina. So when we put the probe in, we are so close to the ovary, it's very easy to stick the needle in. And we do this under ultrasound control. And here's a machine which tells the doctor exactly where the ovary is, exactly where the needle is. So the process is very safe, and we drain every follicle, that's the fluid space that contains the egg, until they're all gone, and we wait to see how many eggs we've got. And this is such a simple, safe procedure. It's just fantastic. You're very lucky to be in the 2000s and have this procedure available to you. So the operation is over and you're wheeled into recovery, and you take about half an hour to recover. And the most exciting part is when I come up to you and I say, you've got 10 eggs. And you look at me and you say, that's fantastic, because you know that we try and get between 5 and 15 eggs. So for you to have 10, 11, 12, it's a fantastic result, and it gives you a very good chance of having some quality embryos for transfer and ultimately a pregnancy.
3 eggs.
Okay. The lady standing behind me, the embryologist, is actually looking for eggs in the fluid that has just been collected from the ovary. And she yells to the doctor how many eggs she's got, so he knows what the count is. And at the end of the day, the patient will wake up and she'll be told how many eggs. This team is fantastic. The girls are very good at looking for eggs. They don't miss them because they stand out. So this is where the journey continues. You've had your eggs collected, they come into the laboratory, and this team that I mentioned before check the eggs and they will inseminate them with your husband's semen. They go into an incubator and they're checked 24 hours later to see if they're fertilised, and if they're fertilised they are grown for 3 or 5 days depending on the doctor's wishes, the patient's wishes. So whether you have a fresh transfer or a frozen transfer, that will depend on what you've arranged with your specialist IVF doctor. But at the end of the day, there'll be embryos for transfer and a pregnancy, and that's what the journey is all about, getting you a baby. That's what we're all trying to do. Your eggs have been inseminated with the sperm, they're fertilised, now we have to grow them. Just like you put the meat in the oven for 2 hours at 180 degrees, we put the embryos in these incubators and they're warm and there's wonderful culture media, and we grow the embryos. And we'll check them in 3 days, 4 days, 5 days to see that they're growing. And then the day comes when we'll take them out and we will transfer them into your uterus, and hopefully there'll be a pregnancy. Not hopefully, a bit more positive about that, you'll be pregnant. And that's the positive attitude that you need when you come through any IVF program. Think positively, think it is going to work for me, I'm going to get pregnant, and that will help you achieve a pregnancy. But this is the heart of any laboratory. These incubators, having about 8 patients per incubator, they're all numbered, it's all very, very carefully worked out so that no mistakes happen. And this is it. This is where your oven is growing those, well, our oven is growing those embryos for you. The doctors have the easy bit in this thing. We collect the eggs, but the real skill is with the embryologists, because they have to identify the egg, they have to isolate it, they have to inseminate it with the sperm, and these days most of the eggs have a single sperm injected into the egg, and that is a skill that you just can't learn overnight. You have to go and do a special course, and we're lucky here at Monash IVF to have such an excellent team of mainly female embryologists. There is an occasional male thrown in, but they're all highly experienced, highly trained, and that's why we have such great success here at Monash IVF. At last, the embryo is now ready for transfer. So you'll come to our embryo transfer room. You'll sit in this chair, and when the doctor is ready, your legs will go up in stirrups. He'll pass a little speculum into your vagina to find the cervix, and then he'll pass an introducing catheter into your cervix, and then we'll call for the embryo. Everything is done under ultrasound control, so we know exactly where the embryo is going. We like to see it go into the cavity. The embryo is loaded into a transfer catheter and is brought from the laboratory down to this room, and under ultrasound guidance we place those embryos in the middle of the uterine cavity, which gives you your best chance of success. It's like having a pap test. There's minimal discomfort. Sometimes the transfer can be difficult, and sometimes patients have an anaesthetic for the transfer, but 99% of all our patients have the transfer without any problems sitting in this chair. And then they go off and have a cup of tea and a sandwich, and then we wait 10 to 12 days for the pregnancy test to see if they're pregnant. And it gives me no greater pleasure than to ring the patient and send them a letter to say, congratulations on your pregnancy, well done.